Namaskar, myself Dr. Maricha. Today I am going to focus on the role of Shwas Kuthar Ras, a classical Rasashastra formulation known for its effectiveness in Shwas Roga. This discussion is based on a published research article where Ayurvedic treatment has shown significant clinical improvement in a patient with severe respiratory symptoms. Through this case, we will understand how Shwas Kuthar Ras works at the level of dosha, srotas and samprapti, and how it contributes to overall disease management. So let's begin this journey of understanding how Ayurveda works at the root level, not just controlling symptoms but correcting the disease process itself. In introduction, the word Kuthar means X, which indicates its ability to cut through thick and obstructive kapha. This is a Tikshna, Ushna and Kapha Shamak rasa formulation. Primarily indicates in respiratory disorder where mucus obstruction is dominant. According to Yog Ratnakar, one shloka in classical text, Gandham Visham cha eva tankanam cha manashila etani tankan matrani marichani ashtakam ekaikam maricham datva khalve sukshmam vimardayet Trikatum tankan matram cha datva paschat vichurnayet sarvam ekatram sanchurnam kachakupyam vinikshipet. And according to Rasendra Sar Sangraha, etani samabhagani maricham tat chaturgunam iti likitam. Now we see the combination of this formulation: Shuddha Para, Shuddha Gandak, Shuddha Vatsanab and Shuddha Tankan, which is and Shuddha Manashila, which is taken as the one part, Marich as a 9 part, and Shunthi and Pippali taken as a 1 part. Here these 5 ingredients, that is Shuddha Para, Shuddha Gandak, Vatsanab, Tankan Bhasma and Manashila, is an equal quantity, but here one dominant ingredients, that is Marich, according to another text taken as a 4, and other textbook which is taken as a 8 times quantity, but most traditional prefers 8 times quantity of Marich. Here this high proportion of Marich enhances its kapha breaking and channel clearing potency. That confirms that it is a Tikshna and fast acting nature rasa formulation prepared. Now we see here Nirman Vidhi of Shwas Kuthar Ras. First step is a Kajjali formulation. We taken as a Shuddha Parat and Shuddha Gandak are triturated to form a smooth black Kajjali. Now we sequentially add Vatsanab, Tankan, Manashila and triturated into the fine powder form. Now we add Marich, which is a large quantity, and triturated thoroughly. Then added remaining Shunthi and Pippali and triturated. But in some textbook defined as a Nagvelli Swaras taken as a Bhavana Dravya for this trituration, and after drying prepared the Vati, which is a 1 to 2 gunja matra. Now we see the therapeutic uses. According to Rasasar Sangraha, Pratishayam Kshataksheenam Ekadasham Vidhamshayam Rudrogam Shwasashulam cha Swarabhedam Sudarunam Tat Rudrogan Anupane Raso Nashayati Kshanan. According to classical text, it is useful in Shwasa, Kasa, Pratishay, Kshaya, Kshataksheen, Swarabhanga and Shwasashul. Here is rapidly act when it is given with proper anupana. Now we see dosage. Dose is a 125 to 250 milligram, that is 1 to 2 gunja, and use anupana as a Adrak Swaras, honey plus Pippali or Nagvelli Swaras or milk, which selected according to condition of patient and diseases, which enhances the targeted action. Now we see the ingredient wise action. Kajjali act as a catalyst and Rasayani Karma. Vatsanab act as a pain relief activity and reduces breathlessness. Tankan act as a kapha agna property. Manashila, which reduces kapha and catalyst. Also, Maricha used as a Deepan, Kapha Vigatanak, and also Trikatu used as a Pachan and channel clearing Dravya, and Nagveli Swaras, which is a anti-cough activity and also Pachan Dravya. According to Ayurvedic classification, here Vat and Kapha dosh dominant, and Dushya is here Rasa and Mansa, and Sthan is particularly lungs, respiratory tract, amashay and nasal pathway. Now we see the contraindication of Shwas Kuthar Ras. Do not use in heart disease patient, cardiac asthma, generalized edema and pitta dominated condition. Because if breathlessness is due to heart weakness, this medication can worsen the condition. Now we after seeing the side effects, here is the management. If excessive heat occurs, then give with Praval Bhasma or Dadi Mavleha or milk plus sugar. This balances its Ushna and Tikshna nature. Now we conclude here, this formulation reflects the depth of Ayurvedic pharmaceutics, targeted and powerful and precise drug. Correct diagnosis makes it life-changing and wrong selection makes it harmful. Now we see some two articles here. First is a exploration of therapeutic potential and evidence-based application of Shwas Kuthar Ras, which is a scoping review. We are going to understand an important Ayurvedic formulation called as a Shwas Kuthar Ras and its therapeutic potential based on a recent review article. First, let us understand what is a Shwas Kuthar. It is a classical herbo-mineral formulation mainly used in respiratory disorders such as kapha, breathlessness and bronchial asthma. It is described in many Ayurvedic texts but with slight variation in composition. Now an important point is about its ingredients. The core ingredients like mercury, sulfur, vatsanap, tankan and manashila remain mostly the same. But however, the proportion of Trikatu, that is Maricha, Pippali and Shunthi, varies in different texts. Among these, Maricha plays a very important role. Why? Because it contains a compound called Piperine, which acts as a bioavailability enhancer. In simple words, it helps the body absorb the medicine better. It does this by inhibiting certain enzymes like P-glycoproteins and CYP3A4. These enzymes normally reduce the drug absorption. So, when Maricha quantity increases, the effectiveness of the whole formulation also increases. Next, let's understand the concept of synergy. All three components of Trikatu, that is Maricha, Pippali and Shunthi, works together. They improve digestion, that is Deepan Pachan activity increases and drug absorption activity increases. So they act as a yogvahi, means they enhance the action of other drugs. Normally, Shwas Kuthar Ras is prepared by making kajali and then added other ingredients. But one classical text suggests a different method. First grind Maricha thoroughly, then add other ingredients. This leads to better grinding, smaller particle size and better mixing. So the final product becomes more potent and uniform. Now let us discuss safety. Preclinical study shows that Shwas Kuthar Ras does not cause serious toxicity. Even at higher doses, it is relatively safe. Next, the pharmacological action. Research shows that Shwas Kuthar Ras has multiple effects, that is antimicrobial activity which fights the against the infection, antitussive activity that which reduces the cough, anti-allergic activity which reduces the hypersensitivity, also anti-asthmatic activity which relaxes the bronchial muscles, It also reduces inflammation and decreases mast cell activity. All these actions makes it very useful in asthma and respiratory diseases. Now let's look at clinical findings. In patient with bronchial asthma, frequency of attacks reduces, severity decreases, breathing improved. Different anupanas like honey, ushna jal and adrak swaras also enhances its effect. However, we must also understand the limitation. Many studies have a small sample size, do not follow proper guidelines like consult or something, lack control groups, so the scopic evidence is not very strong yet. Here is the final conclusion. To summarize, the Shwas Kuthar Ras is a powerful Ayurvedic formulation, works through synergistic and bio-enhancing action, effective in respiratory disorders, has a good safety profile. So remember, the strength of Shwas Kuthar Ras lies in its synergy and bioavailability enhancement, especially due to Trikatu and especially for the Maricha contents. Now we see the second research article, that is a one case study which is ABPA case treated with Shwas Kuthar Ras. Now today we will discuss this case which is called as Allergic Bronchopulmonary Aspergillosis, that is ABPA, and was successfully managed with Ayurvedic treatment. Before going to this case, let us understand what is ABPA. ABPA is a chronic allergic disorders of the lungs. It occurs due to hypersensitivity reaction to fungus called as a aspergillus. Now this is an important, the fungus itself is commonly present in the environment, but in some individuals, especially those with asthma and weak respiratory immunity, the body reacts excessively, leading to inflammation in the lungs. Because of this, patient develops symptoms like persistent cough, breathlessness, wheezing, recurrent respiratory infection. So in Ayurveda, we can correlate this condition mainly with tamak shwas with kapha-vata predominance and allergic components. Now coming to the patient. A patient is a 30 years old male suffering from chronic respiratory symptoms, likely not getting complete relief from conventional treatment. This suggests that the disease was chronic and recurrent in nature, involving kapha accumulation, vata aggravation and allergic hypersensitivity. Now observe carefully, the treatment was not a single drug but a combination therapy, which is a key principle in Ayurveda. The medicine used were Shwas Kuthar Ras. It is a main drug. This is the core medicine in this case because it works by dilating the bronchi, which making breathing easily, reducing kapha and controlling allergic reaction. So it directly targets breathlessness, airway obstruction and allergy. Now second drug is Sitopaladi Churna. This is a classical formulation mainly for cough relief, throat soothing and mild immunity support. It helps in reducing irritation and frequency of kapha. Third is a Lakshmi Vilas Ras. This is a herbo-mineral formulation with antimicrobial action and anti-inflammatory properties. So it helps in controlling infection and reducing lung inflammation. Now fourth is a AFA Respiro Detox formula. This formulation focuses on removing AMA, improving lung function and supporting respiratory immunity. Now understand the sequence of the treatment. In initial phase, focus on reducing the symptoms, detoxification and clearing the mucus, and after later stage continue use of Shwas Kuthar Ras and Lakshmi Vilas Ras for stabilization of Pranavaha Srotas. This shows a stepwise Ayurvedic management, that is a Shodhan-like effect, second is a Shaman effect, and third is a Rasayan-like stabilization. Now outcome of the treatment. After treatment, the patient showed reduction in kapha, breathlessness and wheezing, and improvement in lungs function and overall quality of life, better disease control without major complications. This indicates that the therapy works at both symptomatic and root causes level. Let's understand the logic. Shwas Kuthar Ras act as a bronchodilator and anti-allergic. Trikatu effect in Shwas Kuthar Ras, which enhance the drug absorption. Sitopaladi act to control the cough. Lakshmi Vilas Ras, which fights the infection, and detox formula, which removes the ama. So the combination provides symptom relief, immune modulation and reduction in hypersensitivity. This is called as a synergistic effect. Now this case highlights an important principle, that is a respiratory disease are multifactorial, so treatment must be multi-drug and multi-targeting, not just symptom based. So to conclude that ABPA can be correlate with stomach Shwas with allergic components, and Shwas Kuthar Ras plays a central role in management. Combination therapy gives better and holistic result, and Ayurveda focuses on doshic balance, strota shodhan and long term stabilization. Now this case shows how Ayurveda formulation like Shwas Kuthar Ras, when used in a rational combination, can effectively manage complex allergic respiratory disorder by addressing both symptoms and root cause. The Shwas Kuthar Ras demonstrates significant potential in the management of respiratory disorder through its synergistic and bioavailability enhancing properties. While classical knowledge and clinical observation are promising, there is a clear need for well-designed scientific studies to further validate its efficacy and safety. Integrating traditional wisdom with modern research can open new dimensions in evidence-based Ayurvedic practice. Thank you.